in the same category, and they're just kind of anti-totally. But scientifically, like I was just showing, EC works much earlier than that. It works to prevent fertilization. So long before an abortion would even be possible, EC has its action. And fortunately or unfortunately, however you want to look at it, if you're already pregnant, it's not going to work. So this is a new question. A 17-year-old male student asks you for Plan B. You advise him to go to a local pharmacy, to have his girlfriend go to a local pharmacy, or to have his girlfriend get a prescription from her doctor. There's some abstainers on that one. This was a tough one, and I will admit that this was something I learned in preparing for y'all's presentation, because I don't take care of men on a routine basis. This was not something that I knew. But when we think about who can get Plan B without a prescription, anyone now who's 17 years or older, and this includes men, can walk in without a prescription and obtain Plan B. That means that any women who are 16 or younger must have a prescription. So could not get it no matter what without a prescription. We talked a little bit about the cost, and I always like to make this point because it is wonderful that we can now, for some people, get it without a prescription for anyone 17 and older. But there's a large group of people who have, say, Medicaid or other types of insurance that actually cover Plan B or types of emergency contraception. And for those people, if they have a prescription, it will be more affordable, most likely, depending on the pharmacy, if they're not paying out of pocket. No. So, yep. No. They cannot get a prescription because you would have, it's kind of like buying cold medicine. You don't necessarily have to take it yourself. You could go in and buy it for someone in your family, for example. But if you have a prescription, it's designated for you. Yeah. So it is not for men to take, but they can obtain it in the pharmacy. I don't think anything bad would happen to them, but most men don't want to play around with female hormones. Yeah. So I also want to make the point that it is behind the counter. So that's an important distinction. Something like Advil would be considered over the counter, where you can just walk into a store and it'll be on the shelf and you can pick it up yourself and walk out and pay for it and buy it. Behind the counter means that you actually have to still go to the counter and ask someone at the pharmacy for it, because they keep it. They probably make you sign something, show your license. I'm not exactly sure. Probably like Sudafed now. So it's behind the counter. So I make sure to tell everyone, especially young women, that, because I think kind of like buying condoms, people feel a little skittish when they're going in and they're kind of embarrassed. And so if they look around on the shelf and they don't see it, they're probably going to hightail it out of there. So I try to have that conversation up front with them, like, hey, this is awesome, it's available to you, but you actually do have to go up and ask for it. So. And permission is not required. That was one of the questions on the pretest as well. Although it's definitely not required for 17 years or older, even for younger teens, as physicians at least, we can prescribe them contraception if we feel it's in their best interest without parental permission. Okay, to prevent pregnancy, a woman must take Plan B within 24 hours. True or false? This is another one of your pretest questions. False is correct, although if you take it within 24 hours is the most effective time to take it, but it could be extended later. So when we think about when to take Plan B, you can take it any time up to 5 days after unprotected sex. The package is going to say within 72 hours, which is 3 days. Okay, that's how the FDA approved it, so that's what the box says. But there's a lot of science that supports taking it up to 5 days and that it could be effective up to 5 days. So anyone that's asking you about it who's had sex unprotected within the last 5 days would be a good candidate and may get some effect from it. That being said, the sooner they take it, the more effective it's going to be. So if they can take it within the first 24 hours, that's ideal. But that's not to suggest that there's no purpose in taking it, if they're at day 4 or day 5. What about this one? EC is not as effective in preventing pregnancy as regular birth control pills. True or false? So a little bit more spaced across. I mentioned that regular birth control pills, I think this is exactly how it was worded on your pretest. It might be a little bit misleading, but the answer to this is true. Whether you're using, how well does it work? So whether you're using, if you're using your birth control pills as a form of EC, the way I described and I'll talk about a little bit longer, then packaged or prescribed or marketed Plan B works better. But Plan B does not work better than using birth control pills or any other method prior to having sex. So that's an important point. It's really a backup for birth control prior to sex. The ideal is definitely birth control prior to sex. Plan B reduces your chance of getting pregnant after unprotected sex by about 75%. So that's pretty dramatic. It's not as good as the 92, 95, 99% effectiveness of the things that we can use prior to having sex. But it's still much better than doing nothing at all. As I've already mentioned, I think you've probably taken this point home. The sooner you take it, the better it works. There's also a question about how often you can take it safely. So there's no limit to how many times in one cycle or how many times a year you can take it. The point that I'd like to make is if you have someone who's taking it multiple times, it's a perfect time for intervention to talk about why that's not effective and why they should be using something kind of constantly before sexual intercourse. But from a medical perspective, there's no reason that it's unsafe to take it multiple times in one cycle or multiple times throughout the year. I think I've made that point. Okay. So another question. There are no known long-term side effects of EC. True or false? So, true. That is correct. When we think about birth control pills, this is less a factor in teens because so many teens are pretty healthy. They haven't yet developed a lot of chronic medical issues. But there are kind of a whole list of reasons that some women with chronic medical issues should not use regular birth control pills. And we talked about the fact that there's the same hormone in regular pills as there is in EC. However, because you're only taking Plan B like a little snapshot in time, it's not something you're exposed to every day like you are to a birth control pill, no medical conditions are considered to be a contraindication or a reason not to take emergency contraception. And it has no known long-term side effects, including if you happen to take it, let's say you had a negative pregnancy test, so you took it, and then 2 weeks later you find out that you were pregnant at the time that you took it. It doesn't harm a developing pregnancy. For people that you come into contact with who have taken EC and they're wondering what's going to happen now, the most common side effect, although even this side effect is not that common, is nausea. And in terms of getting your period after you take it, most people will get their period within the month or the 4 weeks after they've taken EC. But it may not be a totally normal period. So it might come a week early, it might come a week late, it might not be the same length or the same amount of flow that they're used to having. But they should get their period within a month after taking EC. And if they don't, they should be concerned about pregnancy and take a pregnancy test. I actually encourage people that I talk to about EC to go ahead and take a pregnancy test 2 weeks later, no matter what, to confirm that it's negative, with the idea that anyone who has a positive pregnancy test, I'd like to get into options counseling sooner rather than later. so that if they're opting to terminate or opting to initiate prenatal care, they can get to those respective places quickly and have things, run smoothly. So have you guys ever heard of Ella? This is just for my curiosity, yes or no? Before today. Too late, you've already pushed your button, right? So for at least 3/4 of you or close, you haven't. And it's been around now for about a year, approved in the U.S. for about a year, but they haven't really done any hardcore marketing, so a lot of people still haven't heard of it. So Ella, sorry, this is a blurry picture, but it's ulipristal acetate is its kind of trade name, but its marketed name is Ella, much more pleasing. And it's also approved, and this one's actually FDA approved to be taken up to 5 days. But really that time frame is the same as Plan B, although the boxes will say something different. They're both within 5 days after unprotected intercourse. Ella is a different medication. So ulipristal acetate is a medicine that blocks progesterone receptors. So it works very, at a scientific level, it works very differently than Plan B. But it still has its main way of preventing pregnancy is by stopping you from ovulating or spitting out that egg. So their mechanism, although it's very different in the underworkings, the result is the same, that you don't ovulate if you've taken this medication, or your chance of ovulation goes way down. The reason that Ella is a great advance for us is that it is actually more effective than Plan B, especially on days 4 and 5. So I mentioned that Plan B, as you get day 1, day 2, 3, 4, 5 away from your episode of unprotected intercourse, the effectiveness of Plan B goes down, down, down. Ella actually is equally effective throughout that time frame. So that's a big advantage of Ella, is that it's more effective, especially when you're talking about someone who is 4 or 5 days out from their episode of unprotected sex. The major disadvantage at this point is that it is prescription only for everyone, no matter how old you are. So that represents a barrier for some people to actually getting it. I don't anticipate that that's going to change the way that it did for Plan B. I suspect that it will remain prescription only because of the scientific differences between the medications themselves. So that kind of leaves us with the question, if we're talking with teens or dealing with them, when should they use Ella instead of Plan B? So I would say, especially if you're dealing with someone who has come to you on day 4 or 5 after unprotected sex, if there is a way for them to effectively get a prescription, Ella would be the preferable method. If there's not a way for them to get a prescription and they're 17 or older, it's still, please encourage them to use Plan B and go to the pharmacy to get that. The USP method, which is just using regular birth control pills but in a modified fashion, has been around for a really long time. It is not as effective as Plan B or Ella or using an IUD, but it is more effective than doing nothing. And the advantage of it is if you have someone who's already taking birth control pills who can't access these other ways, they have it with them. They have the capability of doing it already. This website, ec.princeton.edu, which is actually a place where you can find lots of information about emergency contraception, but specifically they have the list of birth control pills that you can use for EC, and there are about 20 different brands, and they tell you exactly, take 5 of the pink pills all at once, or take 4 of the pink pills or 6, or whichever, depending on which pill you're taking. So if there's someone who can't get one of these other products for some reason, but they're already on a birth control pill, there's a pretty good chance that what they're using already could be adapted that month to give them protection. And that's called the USP method, after Dr. USP, but it's just using regular birth control pills. And then last but not least, I mentioned that you could use a copper IUD. It is very effective. Copper IUDs in general for birth control work because copper is such a potent spermicide. So copper IUDs are as effective as getting your tubes tied, but they're reversible. And they have the added benefit that they could be used for emergency contraception. So this is ideal for people who come in needing emergency contraception who also indicate that they're interested in using an IUD for their birth control method. If they're within that 5 days, we can place the IUD, it's very effective, and then they just continue using it. It's not a good method for someone who's not interested in using the IUD but just wants, to prevent pregnancy right now. And teens, of course, we select very carefully for IUD use, but many of them are good candidates. The old thinking was that, before you've had a baby or you've ever been pregnant, or if you're a teenager and you might have multiple partners, that you're not a good candidate. But within certain parameters, teens are actually great candidates for IUDs. And so if it's something that they mention, of course it requires a visit to a doctor, but some people might be really good candidates for this. And I would say this is the most effective option that we can give. But most teens are going to prefer one of the others. So in summary, I would say that Plan B is very effective for backing up your birth control, but again, using something prior to intercourse or using it as an opportunity to talk about the benefits of abstinence, are key. When possible, take it right away, but anytime up to 5 days after unprotected intercourse. And that's true for Plan B, for Ella, for the YESP method, and for IUDs. It does not cause abortion. It does not harm a fetus if you accidentally take it before you realize that you're pregnant and you decide to continue your pregnancy. You haven't done any damage to your pregnancy in that instance. It's available behind the counter for girls and boys who are 17 or older. And again, behind the counter means you have to actually ask for it. It's available to women that are younger than that if they have a prescription. And so for the few of you who might be seeing them in a setting where they're in a clinic, having an advanced prescription is often very useful for 16 and under so that they don't have to go through the system to acquire their prescription after unprotected sex, if they already have it with them in their bag or they're at home or what have you.
Are most physicians willing to do that?
Most OBGYNs. It's a good opportunity if you have someone who needs EC or is asking you about EC. That's a great opportunity to talk to them about abstinence and other birth control methods that they can use prior to sex. But those two things are not mutually exclusive. They can both get EC and ideally initiate another method. Or if they're on something that they're not using that effectively because they're missing pills, etc., switching to something more effective, like an IUD or an implant. And Ella, which is new and prescription only, would be the preferred method because of its increased effectiveness if they have the ability to access a prescription for it. And if not, Plan B is still a great choice.
Even though Ella is
No. Ella is equally effective throughout, but it works by preventing ovulation. So you don't want to give yourself any window to miss taking it prior to ovulation if possible. If you were to wait till day 4 to take it and you ovulated on day 3, you've missed the boat. But unlike Plan B, which every day, even if you take it before ovulation, every day its effectiveness decreases the longer you wait. Ella has the added advantage of being equally effective days 1 through 5. But you still have to take it prior to ovulation. And most people don't feel when they ovulate, so the sooner the better to be sure that you get in that window. Does that make sense? What other questions do you guys have?
Do any of these forms, I think you covered it, I just want to make sure I've heard other information elsewhere. Do any of these forms actually prevent the fertilized eggs from attaching to the uterine wall?
I would say
more difficult?
the copper IUD probably has that as one of the ways that it works. The other methods are all prevention of ovulation, so prior to fertilization. The copper IUD is a very potent spermicide, and so that's probably one of its primary mechanisms, but it also does cause kind of a change in the uterine environment that might make it difficult to implant after fertilization. It's the only one that would fit into that category.
Are there different side effects with Ella? Are they more likely to
Mm-mm. They're pretty comparable. You know, a few people report nausea, a few people report a headache, but by and large, because it's kind of a one-time dose and it's pretty low, both of them are not associated with many side effects. I don't know for sure about Ella, but I think that it does. But I would have to double check.
Can you find out? Maybe you can email it out. You've got to contact everybody.
Yeah, that'd be great. Other questions or real life scenarios that you've had that I didn't talk about? All right, in that case, I would just say go forth and help them do many things, one of which would be prevent unintended pregnancy.
And if everyone would now complete the process,
Oh, yeah.
to me, that would be great.
Okay.
Thank you.
You are so welcome.
And turn in your little clickers up front. Wait, can you see technology?
Mm.